Hello and very warm welcome, everyone. Thank you for joining today's session that has been organized for the candidates who are appearing in BST General Internal Medicine interviews. My name is Dr. Ali Raza, and I'm running this organization called Doctors Relocation Ireland, as many of you already know. Very delighted to work for HSC NDTP for the year 2024 and 25 as a lead NCST GP. We very welcome all of you here for joining today on Saturday. Uh, just before I start the session, I would just like to inform everyone that this session is going to be recorded. I would request everyone to please keep their mics mute during the webinar. We'll give everyone a chance for question and answer at the end of the session. Before any further delay, as many of you already know, Doctors Relocation Ireland is a closed WhatsApp community of doctors that was established in 2023. Our main purpose was to help and assist doctors to find accommodation when they relocate after every 6 months or a year. We are very happy to help hundreds of doctors so far for this cause. And we've also worked for the academic sessions like webinars for different training schemes. And in our group, there are queries related to visa immigration and any other professional related life for the doctors working in Ireland. Before any delay, I would like to introduce all of you with our panelists today. We are very lucky to have Dr. Talha Rizwan today, who is a lead NCHD in St. Luke's Hospital, Kilkenny. Dr. Talha is also a lead NCHD in Dublin and Southeast. He's working with HSE and NDTP at the moment. We also have Dr. Tiago Amaral today in our panel as well. Dr. Tiago is a geriatric SPR in St. Luke's Hospital, Kilkenny. And then we have Dr. Khalid Kihani on our panel today as well. Dr. Khalid is respiratory SPR in St. Luke's Hospital, Kilkenny. We are very lucky to have in our panel one of my colleague who's a GP in Tipperary, Dr. Oisin O'Carroll, who is going to introduce about Denovo, which is a financial assisting tool for the healthcare workers and doctors, and will probably share happy news at the end of the webinar as well. Before any further delay, Dr. Talha Rizwan, do you mind to take over and start your presentation, if that's okay?
Thank you, Dr. Ali Reza, for the kind introduction. I hope I'm able to share my screen there and everyone is able to join me as well. So thank you very much, everyone, for joining us. I'm very thankful, especially to my colleagues, Dr. Tiago, Dr. Khalid, and Dr. Ali Reza, for supporting me in this webinar. I know Dr. Tiago is also on call as well, but I managed to convince him to join our today's session. So thank you again. We'll try to make today's session as productive as possible. And today's session would be basically more interactive and untraditional. And my colleagues would be joining in the presentation throughout as well. So like Dr. Ali Raza mentioned, I'm currently in my BST second year GIM in St. Luke's Hospital. I'm the lead NCHD in St. Luke's as well, and regional lead NCHD for Dublin and Southeast Ireland for 2025 to 2026 session. And I'm very much obliged to be an executive member and training and education lead for Doctors Relocation Ireland as well. So I'll just share one simple slide just for our audience for an overview of BST GIM interview. Probably most of our candidates already know. It's a 10 to 15 minutes online interview where usually there are two interviewers who are both BST and HST trainers. Usually you'll get two scenarios that can be clinical and ethical, or a few different parts as well, which I'll be sharing shortly. And the four main areas assessed are your knowledge and clinical acumen, your communication skills, which is your grip on English language, your attitude, which is your professionalism and positivity, and then your fitness and motivation for BST. And whenever you're taking an interview, there are basically three parts. You start the interview, you have a dialogue with the interviewer, and then you close the interview. So throughout our session, we'll be focusing on each part. So it's very important to know the pattern, the type of questions, and prepare your answers. Just one important thing, that in today's session there will be no real interview questions shared, because we're not supposed to share anything at all. These are just practice scenarios and example scenarios which we'll be sharing. So just a heads up before we start. Now I'm going to share the platform with my colleague Dr. Tiago Amaral, who's going to share this important slide and share his experience. Dr. Tiago, over to you.
Um, First of all, can everyone hear me correctly? Maybe Tala, if you just could say that, can you hear me okay? Good.
Yes.
And first of all, many thanks for the introduction and for the invitation to participate in this webinar. As a non-Irish medical graduate myself, and although I'm on call today, as mentioned, as Medical Reg, I felt that I could try and help other non-Irish medical graduates, as I had to go through that pathway myself. And look, it is not as streamlined sometimes, but I eventually got into the HST in geriatric medicine, and I'm very happy. So this is kind of more of a motivation part for those people that are not in the training scheme at the moment and feel that their odds of getting into one might be less compared to other people, but it is possible. Okay, and the opportunities are there. It might be slightly trickier, but the opportunities are there for everyone. I think when I did my BST interview, I reflect on it now compared to what I am able to do now and what I did for my HST interview. And it's really the interview in BST. I'm not going to go into much specifics because Tala has a very good presentation ahead. But about, you have to be smart about it. Like, you need to be smart about how you present yourself and how you answer the questions. One of the things that I was taught in med school is that we should always emphasize teamwork. When we write a discharge summary, we say, we did this for the patient. When we refer a patient or present a patient, we say, we did this, we did that, and the patient is known to us. The BST interview, as the HST interview, is more personal. You have to sell yourself. And don't be shy. It's complicated coming from a background of saying we work as a team to say, I did this audit. My audit did this for the patients. I participated in this. I am the lead of this. I am part of a committee. It's important to use the word I, and it won't come out as arrogant, depending on how you present yourself, but it's important to use that. So that's the first part of my tip. Then it's being smart about the scoring system. So obviously you should put emphasis on your background, but when you look at it, having a master's and being the top of your class is actually 10 marks out of 100. So if you have it, that's great, but I wouldn't lose too much time on it, because you can say, I have a diploma, I have a master's, that's it. You don't need to dig into it and say, my master's changed medical practice in my hospital. It doesn't matter. It's 5 points. They'll score for the master's. And then it's more about, where do you get the points from? So you see the questions, it's 34 points. You have to have 7 points in the second question, and you have to have 7 points in the second question, which is usually the ethical or conflict question. So it's a really emphasis on personal skills and communication skills. When you go into the interview performance, what does that mean? It's 10 points. So it's about how you present yourself. You have to be professional. You have to be in a good environment, a good bright light. Its ability to be presenting yourself with confidence without being arrogant. And it's being calm and composed in your answer. So don't rush through things. The medical BST interview can take 7 minutes, like mine did, 8 minutes at most. You will try and rush through it and spiel out all your CV. It's better to get big things out than to try and get everything out. It will be confusing for the interviewers. Then communication skills. So kind of going back to the interview performance. So it's being clear in your explanation. It's being logic. It's being chronologic. So don't go back and forward in your timeline since graduating. It's being empathic with the interviewer. So you could not crack a joke, but you could try and build some sort of empathy with the interviewer and explain that this is what you want to do. You are very much keen into getting into the BST as progression of your career, and kind of passing on that feeling to them, and how kind of happy and almost, I wouldn't say, no, happy is the good word, to have been given the opportunity to even participate in the interview part. And then, we're going to research and qualifications. That's 20 points. Again, from my experience, if you have 3 audits and you have 2 audits, you're going to score the same. So it is important to do audit as part of your professional competence scheme. You have to do an audit a year, but don't, again, oversell audits. Say, I did an audit about this, and then an audit about that, and then an audit about this. No. You can say I did 3 audits, and then highlight the one that actually had some sort of an impact. And if one was published in a national meeting, highlight that one and say that the other one was published at the local level. But again, don't say I did 15 audits. You're going to score probably the same. Okay. So try and do a case report instead. Try and create a pathway within the hospital, things like AFib pathway, DVT pathway, if your hospital doesn't have one. So try and do things a bit out of the ordinary, because everyone is doing audits. And if you go to an interview and say, I did audits, they're going to say the other 16 candidates did audits already. So you have to stand out, and saying that you did an audit is good, but it won't make you stand out particularly. And then professional development. So professional development is things like Tala himself being the lead NCHD, is being involved with committees, it's being involved with the hospital, it's being involved with RCPI. It can be at the local level. It could be just a part of the well-being committee of your NCHDs. It don't necessarily need to be the lead NCHD, but try and do something within the hospital. Obviously, it's all about how that the experience of management and leadership then translates into your performance as a clinical doctor. And the interviewers would like to hear that you are actually doing something aside from clinical medicine, and you are actually starting to build up your leadership and management skills. Because, surprise, when you apply for a consultant post, they won't ask you any medical questions. They'll ask you about leadership. They'll ask you about management. They assume that you know medicine by the time you're a consultant. So it is important that you start to build on that early. And with that, I'll leave it to Tala. I might change myself to no view because I'm still on call, but I'll participate at the end. And thank you very much for the opportunity again. And best of luck. Thank you.
Thank you so much, Tiago. Thanks a lot. I think that is very important for all of us. Like all this information is very, very clearly mentioned in our CPI website. So one of the tips I would like to give to all participants appearing in the interview is to go through the website, to know what you're preparing for, what is the interview pattern, how you can sell yourself. So like Tiago mentioned, like you have a marks distribution scheme already in front of you. If you're not aware of it, just make yourself aware of it. And you should know how to sell yourself. It's a combination of everything: your interview performance, your communication skills, your research, your professional development. So everything, each and everything carries marks. So just go through it. So without any further ado, we'll continue with our further presentation. Sorry, just a second. Yeah. So like I mentioned in the start, whenever you're taking an interview, there are 3 parts. So when you're initially in your start in your early 2 or 3 minutes, your interview has already started, even though the interviewer is not asking you questions, but he's observing you. He's noticing everything, and that carries actually weightage in your interview. So in this slide, I'm emphasizing on the start of the interview. So when you're starting your interview, it should be only one and only you who should be present. You should have good internet connection, good lighting, good mic and video quality. You should dress well. You should have a clear background. So all these things basically matter, and sometimes it not sometimes, it always creates a good impression on the interviewer, and you'll probably score higher if you're focusing on these things. And then when you're starting your interview, the usual bits are done: security checks by the tech support, your IT, mic, camera, everything, screen visibility is checked. And then you're asked for a declaration not to disclose any questions after the interview. And then the interviewers introduce themselves. So this is basically a grill of the first 2 or 3 minutes, or maybe less than that. But you're still, like I've highlighted here, interview has already started even before the questions. So what you should do is not to stay blank. Don't show you're nervous. Have a positive attitude. Stay confident. Your shoulders should be straight, looking front, smile, and nod your head. Your interview has already started. So please keep that in mind. Then the second part of your interview is the dialogue, where you will be asked questions from the interviewers. So I'll be focusing more on the dialogue in today's presentation. It's very important to know what type of scenarios and questions you can be asked. So I've basically grouped into 5 parts. There can be general questions about yourself, your clinical experience, your background, and your CV. So as you can see, I've highlighted in this slide that you should know yourself well. People can say, I know myself very well already, but sometimes you don't even know how to present your CV. So it's very important to know yourself well and how you should be explaining yourself to the interviewer. So that is one part. Then there can be questions related to BST. There will be clinical acumen questions, which carries the major bulk of the marks. Then there can be ethical scenarios, breaking bad news, conflict scenarios, difficult colleague scenarios, any one of these. And then there can be questions related to audits, research, quality improvement projects. So you already know what type of questions can be asked. It's just to prepare yourself for those questions. So we'll go one by one about these categories, and we'll hopefully at the end of today's session, you would know what is the best approach to answer these kind of questions. So general questions, your interviewer can ask, tell us about yourself, run us through your CV, introduce yourself. This is the basic kind of question of every interview. So what should be your approach when you're answering such kind of questions? You need to make sure that you're not going here and there. You should have a proper set approach when answering these kind of questions. So firstly, when you're asked this question, you nod your head, you say thank you for the question. It creates a positive attitude, as I've mentioned in the bracket there. And then you tell your full name, your current designation, either you're a reg or an SHO or an intern, and then your department, medicine, ED, and then your hospital name. And then you share your clinical experience briefly, very briefly, but in a chronological order, starting from your current role and going back to all roles you've taken till your internship. You don't need to go through each and every bit of your clinical experience, but you need to have a systematic approach when you're telling the interviewer about yourself. And then if you have any qualifications, especially membership exams, relevant diplomas or certification courses, you can mention about those. But it is very important to stay relevant. If you're taking a BST GIM role, you shouldn't be mentioning, oh, I've done a master's in public health. It's not related at all. So stay relevant. Then if you have any teaching experience for example, an undergraduate teaching experience for RCPI, RCSI students during your clinical rotations, or if you've organized your weekly grand rounds for NCHDs, you should mention that. And then if you have any leadership experience, you've been part of a lead committee, if you're a lead NCHD, if you're representing any Young Doctors Association, you can mention that as well. And then if you've done any audits, research, quality improvement project, if it is relevant to your field, just mention that as well. And then if you have any achievements, you can tell that as well. That creates a good impression. And lastly, it's very important that you mention your aim, because it shows you have a clear direction where you're going. What do you want to be after completing your BST? So for example, an example statement can be, my aim is to become a consultant gastroenterologist, and in order to fulfill that aim, I want to enter into BST, which is a gateway to HST. So in this example statement, you've already told your interviewer what is your goal. You want to become a consultant. And how would you do that? You would do that by entering into BST and preparing yourself for HST. So when you're explaining about your CV, this is the pattern you should follow. You start well, you conduct well, and you end well. Not everyone would have all these points, but whatever you have, just go through them in a very systematic way, and tell the examiner at your end, what is your focus, what are you aiming for. That is the best approach, in my opinion. Then you can be in the general category. You can be asked, why did you choose medicine? Why did you choose BST? Why do you feel you are the best person for this role? Why should I take you? All these questions have a similar approach and a similar kind of an answer. So basically, like Tiago said, when these questions are being asked, you need to sell yourself. This is an opportunity, which to sell yourself and to tell the interview panel that, why are you best for this role. So like I mentioned in my first point, the approach should be to mention all points which show your determination towards your specialty. That can be either your clinical experience, your exams, your research, your audit, anything at all. So you should take the opportunity to impress the interviewers by showing that whatever you have done so far, that is relevant to BSTGIM. So again, I'm focusing on it very much again and again. Have a clear aim in mind, which specialty you want to pursue. Mention all the positives of that specialty and whatever you have done. So have a clear state of mind, have a clear aim, have a clear plan of action, and mention that to your interviewer. So this should be your approach when you're answering this sort of question: why you want to choose BST, why should I take you, why you feel you're the best person for this role. So main thing is to sell yourself, to tell them your experience, to show them your own aim and how would you achieve that aim, basically. For example, I've just mentioned an example statement just to answer that. Now it looks quite busy, but when you practice these kind of statements, you'll be finishing this statement in 10 or 15 seconds, and it creates a good impression. So for example, if I were to ask why you chose medicine, I would say, I always had a strong interest in medicine because I always wanted to be a geriatrician like my father. I personally witnessed my father helping elder population in need and relieving their distress. That particularly pushed me to pursue geriatric medicine as a specialty. And I'm particularly impressed by the specialty's holistic approach, complexity of managing multimorbidity, and opportunity to improve quality of life. And in order to fulfill my goal, I want to enter into BST, which is a gateway to HST, and eventually for becoming a geriatrician. I believe I'm the best person for this role because I have the relevant clinical experience. I have gained a diploma in geriatric medicine by RCPI. I've passed my membership exams, and I'm conducting a few audits as well related to geriatrics. So this is an example statement. What I have told the interviewer in this statement, I have told my clear aim. My aim is I want to be a geriatrician. I have told the examiner how I will fulfill that aim. I want to be in BST to enter into HST, clear aim. I've showed my dedication towards medicine, that I've done my memberships, I've done audits, I've done diploma. And then I've showed some empathy and sympathy as well, that I want to help elder population to relieve their distress. And I've showed good moral values. So a lot of things I've shown to the examiners just by this simple statement. And it's all about your practice. If you can obviously make it short, but it's all about practice. You need to practice about this statement, what you want to show to the examiner. Then again, this is a very common question which is being asked in the last few. I mean, similar questions, but this is a very common question that can be asked: why you chose Ireland? How was your experience of working outside Ireland? And what is the difference of working in Ireland and outside Ireland? So what people what I've seen, the mistake in this question is that people say bad things about their own country in an attempt to make an interviewer happy. So that might not be the case. He might not be happy with that thing. So like I mentioned earlier, have a positive attitude. You don't necessarily need to say bad things about your own country. um, this should be an opportunity for you to show your aim and dedication towards your specialty again. So basically, this kind of question is checking your professionalism and your moral values and ethics. I'll show you an example statement for this kind of question as well. For example, if I were to ask this question, I would have said, I've worked in Pakistan for about 1 year in medicine, which itself was a great experience. However, I already had a lot of seniors from medical school who talked highly about the Irish healthcare system that motivated me to come to Ireland and gain the experience myself. The other main reason for moving to Ireland was primarily for structured postgraduate training and a healthcare system that values supervised learning, patient safety, and multidisciplinary teamwork. And my experience has further reinforced that decision, and I'm committed to continuing my career and training within the Irish health system, as I believe this is one of the best in the world. So, this is just an example statement, but I have never said any bad things about my country. I've highlighted the good things about Ireland. Obviously, it's not a fake statement, but what I've done is I've showed the interviewers clear aim. I've not said bad things about my country. I've showed the interviewers what I want to do, and what were my reasons of joining the Irish healthcare system. Then you can be asked about your good and bad clinical experience. You can be asked about a recent experience and what was your impact in the patient's outcome. This is also a very logical question in interviews. So what your approach should be in this kind of scenario is that you should show good teamwork, your dedication, your clinical judgment, your knowledge and positive impact. Uh, Important thing to highlight in this kind of situation is that you should mention what you've learned from your experience and what you would have done in future to improve the clinical outcome of the patient. There's a very common mnemonic used for this kind of scenario. Probably most of us are aware of that. So it's a star mnemonic, where you show where you share a brief clinical context, which is the situation, your task, what was expected of you, your action, what you did in the scenario, and your result, your patient outcome. For example, when I were to ask this question, I would say, I remember one example from my gastroenterology rotation where we had a patient admitted with symptomatic anemia. Her HB had dropped after resuscitation. The consultant had performed an OGD, and that was managed eventually. In the meanwhile, I went to take the detailed history from the patient, and I found that patient had been taking double the doses of NSAIDs for back pain without a PPI cover. So I immediately informed my senior. I explained the patient of the likely cause and discharged the patient with a PPI script once she was stable. So on follow-up, we came to know that she was doing great. Her HB had stabilized, her symptoms had improved. So what I learned from this scenario was that history is very important in terms of the management. And next time, what I will do is I will keep in mind the various causes of anemia and GI bleed, including the NSAIDs and steroids. So this is very important that you reflect on what you should have done in order to improve the patient's outcome. In this kind of scenario, examiner is looking for such kind of thing. So please keep that in mind. Then the second category in the interview can be the questions related to BST. What can be the questions? What is BST? What do you know about BST? What are the requirements of BST? What are the mandatory courses during BST? What you should expect in BST? Your hubs and rotations. These are very common kind of questions which are asked. So all our answers are in RCPI website. I would request everyone to go through them. Then the third category is the clinical acumen, which carries the main marks. So the approach is you shouldn't jump to the diagnosis. before starting, take a deep breath, know what information is given to you. Start with the ABCDE approach. Remember the basics: history, examination, investigations. Go with the relevant basic workup. Depending on the scenario, you can tell the specific treatment as well. For example, nebulizers, steroids, antibiotics, all that. Then you should timely escalate to senior, update the next of kin and the family member, document each and everything, and follow up. So you should know the approach, whatever you're following. I'll just give you one example for this kind of situation. For example, you have a 23 years old female who presents to you with sudden onset shortness of breath started 1 hour ago, which is gradually worsening, associated with chest pain and deep breathing. So how you're asked by the examiner, how would you approach this scenario? How would you manage this case? So you say, firstly, my first step would be I would approach this patient firstly by stabilizing following the ABCDE approach. I would check the vitals and according to the act according to the abnormal levels. So as the patient is able to talk, the airway is patent. This is your ABCDE approach. So as the patient is able to talk, the airway is patent. I will check the oxygen levels. If it's low, I'll start them. Then I would go to the breathing part. I would perform a chest examination following inspection, palpation, percussion, auscultation. Based on the positive findings, I will act accordingly. So in that case, examiner can interrupt you by saying some positive findings. For example, he says, you hear wheezes, what would you do now? So you can continue by saying the specific treatment. Don't wait for your senior to mention about the specific treatment. You can mention that. And then the C, I will check the blood pressure, heart rate, capillary refill, pulses. If the patient is hypertensive and tachycardic, I will start IV fluids. Then I will quickly check the alertness and consciousness. D also includes sugars. So if indicated, you can check the sugars, start the treatment on, start the patient on treatment for that. And then quick head-to-toe assessment, that is your E, exposure, to see if there are any obvious injuries, bruises, bleeding. So you start well, you mention the ABCDE protocol. The examiner might interrupt you in the middle to ask for particular things, and then you carry as you go. Then your second to final step, this is very important. After you've stabilized the patient, you take a history, you examine the patient, you request for the basic workup, which is your bloods, your ECG, your chest X-ray, your viral swab, and everything. Then you make sure that you timely escalate to your seniors, and then you update the next of kin and make sure that you document each and everything, and you follow up to see how your patient was doing. So it's very, very important to know the systematic approach. You start with the ABCD, you do the history, examination, relevant workup, timely escalation, update the next of kin, and document each and everything. Very, very systematic kind of approach for this kind of scenarios. This is just an additional thing. Like I mentioned earlier, examiner can give you further information during your management. So don't be puzzled by that. This is to go through whatever has asked. So this is just a follow-up for that. I'll actually skip that part because I'm short of time, but I can forward the slides as well, no problem. I'll come to the other part. So ethical questions, and that can be also asked. So again, this is the approach you should be following. The important thing is your spies and spikes. In the spies, basically, it is seek further information, patient safety, initiate your action, escalate to the senior, and offer support. And spikes mnemonic is usually used for breaking the bad news. I'll show you some examples, and then you'll know more about it. So for example, there is an 80 years old competent patient with severe pneumonia who is refusing IV antibiotics and wants to leave the hospital against medical advice. How would you approach this scenario? So this is your SPI D mnemonic. So what you say in this kind of scenario is, I would seek further information, clarify the situation by assessing the clinical status of the patient, and I will make sure to know whether there is an immediate risk to the patient or not. I will quickly formally assess the capacity and ensure the patient understands everything. Then my next step would be to make sure that patient safety is my utmost priority. I will make sure the patient is clearly understanding his diagnosis, his risk of refusing treatment, the available alternatives in a simple and easy to understand manner. Then I will initiate my action. I will keep in mind that patient safety is my utmost priority. I would again ensure that all red flag symptoms are explained to the patient and he understands each and everything. I will timely escalate to seniors. I will make sure that the patient is aware of the available support. And in case they change their mind, they have the right to receive the treatment. And I will document each and everything in the clinical notes. So this is your SPICE D mnemonic. Then in case of a breaking bad news, for example, you're a medical registrar, you need to break a bad news of a metastatic pancreatic cancer diagnosis to a patient. What would you do in that scenario? So you follow the SPICE D mnemonic. You focus on the setting. It should be a private, quiet room, ideally. Then you ask the patient what is his understanding of the situation. You invite the patient and ask him how much detail of the diagnosis he would like to know. You give a warning shot and explain the diagnosis very clearly and in a way that you're not using any jargons. You make sure you show quite good empathy to the patient, and then you summarize and offer support whatever is available, and you document each and everything in the clinical notes. Then there can be, I will skip that part because I'm running short of time, but just to be aware, there can be different questions. There can be a difficult colleague, there can be breaking bad news, ethical scenarios, all those stuff. So you have the mnemonics for it. You can even Google that, and SPICE and spikes are the most commonly used mnemonics. But the important thing is you follow the approach, you practice the approach, and then you'll be flying. And then lastly, you can be asked about questions related to your audits, your research, your QIPs. So this is an opportunity to sell yourself. You should not. I'll just highlight one important thing about this. When you're asked about an audit or a research, just don't just tell the definition of the audit or a research. Tell what you've done so far. Just take it as an opportunity to sell yourself. For example, I would say audit is this. I've done this audit. I'm planning to do this audit. So tell whatever you've done. So that's the end of my presentation. I know it was a lot, but I tried to share different things and important points about the different type of questions. I'm just going to hand over to my colleague, Dr. Khalid, who will share his experience and useful tips related to BST. Over to you, Dr. Khalid.
Thank you very much, Salha. I'd like to thank the panel for giving me the opportunity today to speak to you in this webinar. I'm not going to take much of your time. I think my colleague Salha has done an excellent presentation that goes through everything, so I'm not going to dwell too much. There's just a few things I'd like to focus on, and Tiago at the start as well as given an excellent summary of what you need to do and of the marketing scheme. So I am a first-year respiratory SPR, currently doing my GIM year in St. Luke's in Kilkenny. It is important that you know going into the interview the structure of the BST, and they can't ask you about the BST because it's a very common question. What is BST? If you don't answer that question right, it is difficult to recover from that. So you need to understand what you're getting yourself into. The BST will be changing in 2027. So if you're applying in 2027, it's a different program. It's going to be a 3-year program, but we will talk about the current system, which is a 2-year program. So you need to know that it's a 2-year program. You need to know that you're rotating through different specialties every 3 months. And you need to know that you're expected to do 3 of the 5 core specialties, which is cardiology, respiratory, gastroenterology, endocrine, and geriatrics. So you're expected to do 3 of the 5. Obviously, if we do all 5, it's good. But as a requirement of the BST, you're expected to do 3 of the 5 in the 2-year program. You're expected to do 6 months in a peripheral hospital. So that's a level 2 or a level 3 hospital. So you can't be swapping to stay in the same hospital. You will have to do 6 months in a different peripheral hospital. And that's a requirement of the program. They wouldn't let you, but just in case that something happens, that you need to be aware of that, and you're not requesting swaps that are outside of the program. And you need to know that they are mandatory courses that you do. So previously you booked your own courses, like the ethics and the courses that you need to do, but now they are allocated to you. So the RCPI will give you dates for these courses. But you need to make sure that you have done these mandatory courses. And the names of these courses, I think it's 4 or 5 courses. The name of the courses are all in the RCPI program. If you've done your part 1 of the MRCP, that's good. It's not a requirement, but it's good. It makes you stand out more, And if you haven't, say that you're planning on doing it, even if you're not, So give a date though, because everyone can say, "Oh, I'm planning to do part 1 before I start the program." Everyone can say that, but not everyone can say, "I booked myself into the part 1 program in April, and I'm planning on doing it, and I'm planning to proceed to do part 2 in August and finish with the clinical before the end of this year." So have a clear timeline, because everyone can say, "Oh, I'm planning to do this, that, and the other." But if you don't have a structured timeline, they know you're just waffling, So you need to be, have a plan in mind. If you've done part 1, say that you finished part 1, you're planning to do part 2 in this month. You don't have to give the specific date, but give the month at least, so they know, that you've looked into it and you're actually planning to do it, Again, I'm not going to dwell too much on that, but make sure you have an audit, and when at least one audit. And if you've done an audit, it's important to understand the cycle of audits. Sometimes they might ask you what's the definition of an audit. So make sure you've prepared that, because that's an easy question. That's a one-liner. So make sure you have a one-liner about what an audit is, and you've completed the cycle of an audit. So they might ask you, what is the cycle of an audit? So that you do an audit, you do an intervention, and you re-audit. So it's important that you know that, and an audit can take you 1 day, or you can complete an audit in less than a week. So even if you have no audits now, it's your time to do an audit now, and be able to say that in your interview, because sometimes you don't have an audit, and it's okay. It's never too late to start, but it's important that you sit down and get your head around it, Teaching is very important. A lot of people do teaching every day. You're teaching everyone every day. If you're an SHO, you're teaching your intern. If you're an intern, you're teaching your medical students, So you're always teaching, but take credit for your teaching. So let's say, when I worked in Beaumont, I was an RCSI affiliated tutor. And what that meant is I reached out to RCSI. I was like, "Oh, I'm teaching the medical students anyways." So I reached out to RCSI. I was like, "Will you give me a certificate at the end of the year that I'm teaching RCSI?" And they were like, "Okay." So they gave me, so I had evidence, and I submitted that as part of my paperwork for the higher specialist training. The basic specialist training and higher specialist training are similar to each other. They're looking for the exact same things. So it's not going to change. It's just building up in your CV. So make sure that that if you're delivering teaching, that you take credit from it. So reach out, see what hospital what university is affiliated with the hospital, and reach out and ask them. You say, "I would like to teach your students. Will you give me some evidence that I can submit when I'm applying for interviews and whatnot?" Do a case study. So if you're doing a single audit, do a single case study. Again, case studies can take you a few hours to sort out. Like even in an hour, you can write up a case study, So it's not going to take you time at all. And if you've done a case study, submit it somewhere. Let's say you did an pneumothorax, whatever, a pneumothorax that was failed management of a drain and required, VATS or whatever, something interesting in the case, you can submit it to the Irish Thoracic Society. And most of these national societies, especially if you're not going international, accept anything that gets submitted to them, as long as, there is something in it, you can discuss it with your consultant, that they will always give you a case that will be accepted. So if you've done all the work, which is working through the case study, you have it ready, you just submit it somewhere, and you can talk about that. And again, these are things you can do in 1 week. Yeah, they're things you can start doing. You don't have to have these things done in the past. You can start doing them now after this webinar, do one audit, do one case study. It's all important. Leadership is very important. As Tiago was saying in your consultant interview, what they're asking you about is your leadership and management. There's nothing medical about it. They're going to expect that you already are proficient. Otherwise, how are you practicing as an SPR for 5 years, or as a registrar if you're doing the parallel pathway, So it's important that you show leadership. And let's say you don't have anything now, evidence, start now. So reach out to your department. Let's say if you're in the geriatric departments, tell them, I would like to organize the journal club. I would like to do the rota for the journal club. That's, that shows management and leadership skills, because you're going to do the rota. So you can say that, oh, I was the rota coordinator for the geriatric department in St. Luke's Hospital, so that you have something to support your claim, that you're able to do, to be a leader, able to manage, and or do what Talha is doing, be part of your committee, lead in CHD. You can do a lot of things to show management and leadership, but make sure you do one thing, because these things, as I said, do not take time, not at all, and it's really disheartening to see people going into the review and not taking an hour just to do that, because like you can do that in no time, like literally in no time. Like, let's say making the rota for 3 months for the journal club, you can do that in less than an hour, like in a few minutes, and someone will do it and take points for it, and you won't, just because you didn't think that you think of it. So it's important, to keep that in mind. Always include your consultant. So always tell your consultant, or you're applying for the BST, you're doing this. Ireland is a small community. Consultants talk, so they could have called up your referee and asked about you. And if your referee doesn't know, or you haven't showed keen interest, they might not give you. They're like, oh yeah, okay, yeah, Talha has applied, yeah. But if Talha has told his consultant and told him, I'm interested, I'm applying, give me tips, this and I was like, oh yeah, Talha is very keen, yeah, of course he will get on. And then that's your positive get in, So it's important that your seniors know, because everyone talks, and Ireland is small, everyone knows each other. So make sure that your seniors know you're applying, and it gets you to where you want to be. They're not looking for a perfect consultant. They're looking for someone who's safe and reliable and has insight into their weaknesses and knows when to escalate. That's really what they're looking for. A team player that knows when to escalate. They have insight into their limitations. Nobody's expecting you to manage everything. You come across, even if they give you a scenario and you're uncomfortable with, do what Talha has been going through his presentation. Break it down, go through it systematically. That's what they're looking for. They're not looking for you, to have the exact answer, because sometimes, clinically you wouldn't have the exact answer. You will seek help from different specialties. That's why you have consults. And that's really it. I'm not going to dwell too much. Make sure that when you're presenting yourself, you present yourself well, and as Talha said, have a concise summary about yourself. Like, you need to start the interview with something you have memorized. You can't be thinking of what you're trying to say. Like, something you have memorized and you're just saying it. Like, you need to be saying it to yourself every day. And, you come to the interview as, my name is this, I'm doing this, that, and the other. And you give a summary about yourself. And that can take you anywhere from, for the HST with the 2 to 3 minutes, maybe for the BST, half a minute to a minute, will suffice. Don't give a long summary, because they will stop you. If you're talking too much, they will stop you. And it will look very bad, because you won't be able to, say the things that you wanted to say about yourself. So have a concise summary about yourself, memorize it, and just say it. And that's really it. Thank you very much for the opportunity, and I'll hand over to Dr. Ali.
Excellent. Wonderful session, guys. I'm already receiving a lot of positive feedback, and I think the three of you has done a really, really good presentation and talk today. Wonderful. So without any delay, we have another amazing guest speaker today, Dr. Oisin O'Carroll, who's going to tell us a little bit about Denovo, which is, again, a financial assisting tool for the doctors. But I let Dr. Oisin to highlight what actually it is. Dr. Oisin, are you ready to take over?
For sure, yeah. Thanks. Right. Hello?
Yeah, we can hear you, yeah.
Hear me great. And is my screen sharing, Ali?
Wonderful, yeah, excellent.
Yeah, brilliant. So good morning, or good afternoon, everybody, even. And thanks very much for having me just for a few short minutes to introduce you to our platform, Denovo. Very grateful to Dr. Ali for giving us the slot to talk to you all today. I know you're all very busy and working and whatnot, so I appreciate your time. Myself and Dr. Ali were SHO colleagues way back in 2018, and Ali was a much more experienced pediatric SHO than I was at the time, so he was always a very helpful colleague. And I think the group that you've assembled here is wonderful and really great to have a resource for all of you going through your interviews and things. I think doctors from abroad make up about 40 or even 50% of our workforce in the Irish health system. So we're very lucky to attract such good colleagues. And I think, having groups like this to support all of you is brilliant. So fair play. This is a slight segue from what you're discussing at the moment in terms of your kind of professional lives and your furthering your professional careers. But it's another really important aspect of our lives as doctors. We all work very hard. We all kind of push ourselves through these interviews like you're preparing for to progress our careers. Most of us aren't financially motivated. We're not doctors first and foremost to get rich. We're doing it because we enjoy doing it and we enjoy helping patients. But it is an important aspect of our lives, and a lot of us neglect it to our own detriment. It's important to have a good handle on our finances, to feel supported in managing your finances, to reduce stress and allow you to focus on your career and other things that are important to you. So that's why myself and together with my colleague Kevin Clesham, who's an orthopedic spine fellow currently in Vancouver, we came together to make this platform to support all of our NCHD colleagues. So just a little bit about ourselves. So myself and Kevin kind of were in university together in NUI Galway. We were interns and lived together in Galway in 2015. And as soon as we started getting our first pay slips, the problems started in terms of realizing that we knew absolutely nothing about financial planning, financial management, or how to organize ourselves. It started with payslip errors. Pretty much any kind of error on a payslip that you can imagine, it's happened to either myself or Kevin over the years, and we've had a lot of experience dealing with HR and different bodies, including even the Workplace Relations Commission, to get payslip errors sorted. So we're pretty experienced in trying to spot and sort out payslip errors. But back when we were interns, we spent a lot of time trying to figure out, ask each other questions. Should we be saving? Should we be investing? Did we understand our pension? Was our pension deductions correct on our payslip? We didn't have any idea. So we decided to seek out professional financial advice. So both myself and Kevin went to independent financial advisors separately. And we weren't really happy with the kind of vague, bland, generic advice that we got from people who really didn't seem to understand kind of the complex situation that we were in as kind of NCHDs, and the complexity to our careers and moving around and multiple different employers that it had. So we weren't quite content with what we got. We also realized that we were kind of very time poor and it was very hard to find advice. So we eventually fell into this area by accident, by kind of trying to do more and more research ourselves. That culminated with doing kind of professional exams just around COVID time, and we both became qualified financial advisors in 2021. Shortly after that, we came into contact with a financial services company called SYS. They're one of the biggest financial services providers in the country. And they were very interested in what we were doing. They kind of realized that doctors were kind of an underserved group in Ireland, and that they had difficulty kind of interacting with doctors. We had difficulty interacting with the financial services profession. So we sat down together over a series of a couple of weekends and kind of hammered out the big problems and how we could address them. So the main problems we identified as to why we all struggle with financial planning were kind of four main ones. So first of all, the financial literacy gap. So we spend a lot of our time studying medicine, but no one tells us about basic financial planning, pensions, investing, savings, even just how to read your payslip. We're all time poor. We're focusing on interviews, exams, trying to have some sort of a social life or a family life. So no one has time to really sit down and kind of study this stuff unless you're kind of interested in it, which most people aren't. The third thing is we all have complex career paths. We move around the country all the time. We've multiple employers, and that really makes things difficult when it comes to things like getting a loan, paying for paying into a pension, trying to secure a mortgage, those kind of things. So it's really difficult from that point of view. And finally, a lot of us have, especially early in the career, in our careers, we have the idea that, look, I'm going to be hopefully a consultant in 5 to 10 years' time. By that time, I'll have it all figured out. I'll be making lots of money, and I don't really need to plan my finances because everything will be fine. But that's not entirely true. We make most of our major financial decisions between the ages of 25 and 35 before most of us become consultants. And that can be hugely costly. For example, this is just a rough example using kind of generic figures, but for someone who starts saving into a pension at 24 with a kind of a standard amount, they can look at having a post-retirement income of 90,000 euros a year, which would be, a very comfortable salary in retirement. If you start saving just 10 years later at 34, that reduces by half to 44,000 a year. So still reasonable amount of money, but significantly less. And if you start at 44 or higher, it becomes very difficult. And you could be looking at a post-retirement income as low as, 20 to 30,000 a year, which would be a huge salary drop from a consultant income. So it's really important to realize this early and start as early as you can. We know anecdotally it's a big problem among our friends and colleagues, but there's also some research to show that it actually is, a definite confirmed problem. This study done and published in the Irish Journal of Medical Science a couple of years ago showed that financial worries were among the top stressors of NCHDs. So I'm just going to really briefly mention what is financial planning without getting into the weeds or any kind of complex areas. So what financial planning isn't, it's not taking big risks with your money. It's not being reckless with your money. And it's not something that you can only kind of look into if you have a lot of money. It's something that we should all be thinking about, even from the very first paycheck that we get. And it's actually something that's quite boring and should be boring. So it's broken into two kind of separate headings. So step one is maximizing your available financial resources. So that's simple things like understanding your income, budgeting properly, optimizing your tax reliefs and credits, and making use of all specific employee benefits that we have. For example, the NCHD support schemes and all the HSE supports that we get during our training. And then the second step is use of suitable financial instruments. So that's kind of where professional financial advice comes in terms of saving and investment plans, retirement planning, protection planning, and loans and mortgages. So I'm just going to run through, there's a couple of questions just to kind of help people kind of gauge where they're at themselves. Everyone will be at a different place or a different knowledge level. Some people will have no idea and already have their head buried under the laptop, so they don't have to listen to this. And other people will kind of know as much, if not more. So, but if you're able to answer these questions, it's a good kind of starting point to see where you're at. So can you confidently read your payslip and identify errors or underpayments? Are you certain that you've claimed all your tax reliefs and credits that you're entitled to? Do you fully understand your current pension and specific value of the benefits that you'll get in retirement? Do you have a plan to maximize your retirement benefits, maximize your tax savings through pension contributions through a vehicle called AVCs? Do you have a clear plan to home ownership in the next 2 to 5 years, if that's something that you aspire to? What would your income be if you weren't able to work for more than 3 months? And would you be able to meet your financial obligations, for example, mortgage repayments, supporting a family, supporting other kind of loans and debt? Do you understand the time value of money and how inflation erodes the value of your savings that's in your normal bank account? And do you have a savings or investment plan to protect and grow your wealth over time? And finally, do you understand the difference between independent and tied financial advice and the advantages and disadvantages of each? So after going through those questions, I just introduced you to the solution that myself and Kevin came up with in partnership with SYS Financial. So Denovo is a fully online platform with a few different features to help you answer those questions and kind of gain further control over your finances. Denovo at the moment, we've been running Denovo for about a year now. We've got just over 300 active users, and the feedback so far is that it's been a really kind of helpful addition to people as they try to navigate their kind of financial life. So Denovo, just you do have to sign up for a free member account. By signing up to account, you get access to all our financial guides and FAQs, all of our calculators, including an overtime calculator where you can put in your hours just as you do in your timesheet. Put in your kind of your pay scale, your tax credits and release, and it will calculate how much you should get paid for that period, and that can be helpful for looking at your pay slips and trying to identify errors and things. And then the third aspect of the platform is the access we provide to professional financial services. So if you want to access professional financial services, there is a fee. However, we've negotiated with our partners, SYS Financial and another partner called Intax, to try and provide the maximum amount of value to clients. So one of the big barriers we had when we were seeking out financial advice was the cost barrier. So first of all, we delayed it for a long time because we thought access to financial advice was going to be prohibitively expensive, and we didn't do it. Eventually, when we did pay for it, it's you should be considered an investment rather than a cost. And by kind of partnering with SYS and Intax, we've negotiated really good prices to access all of their services, which will be much better than accessing them sort of on an individual basis. So through Denovo and our partnerships with SYS Financial and Intax Accountancy, you can access directly from the platform a financial health check. So most people will start with a financial health check if they've no idea where they are or what they need to do as a next step in their financial planning. And that would be a meeting with a financial consultant remotely, going through all your kind of current situation and getting some advice as to how you can organize your financial life. There's also an option where you can submit your pay slip if you're not sure if it's set up correctly, if your tax credits and reliefs are applied properly. And our pay slip team will review that, try to identify any errors, and hopefully save you some money if there are any errors. There's also access to professional advice about, specifics like investing, life assurance, income protection, serious illness cover, all those kind of things. We have a dedicated mortgage service, so our mortgage team is really good, particularly at complex kind of mortgage applications that other mortgage brokers have kind of failed to secure. So if our mortgage team can't do it, it probably can't be done. So it's a really good service for kind of people who have more complex situations, like a lot of us do as doctors with multiple income sources and employers. We also have a really good health insurance expert. So through the platform, you meet with our health insurance expert once a year. They will look at your health insurance, give you advice on, the cost versus the benefits that you get, and they'll make sure that you're getting the most value from the cheapest plan possible. Tax rebates. So a lot of us overpay tax. The average tax rebate in Ireland last year was 11,000 euro or 1,100 euros, excuse me. Most of us leave a lot of money on the table in terms of taxes. So you can submit an application for a tax rebate through Denovo, have them review your tax, and hopefully secure a tax rebate from the previous year. And then we have accountancy services as well for people if they have slightly more complex situations. You can get an accountant to actually look at your tax services and do a tax return for you. So that's just a summary of the professional side of things. Again, this is optional. Most of the services through Denovo are free, but if you want to access the professional services through our professional partners, there is a fee. I'm almost done. This is just this is a bit of an outlier, but it's just an example of how valuable kind of getting appropriate financial advice can be. So one of our users last year, one of our first users actually, they set up a pension with us and got 4,000 euro back in tax relief. None of their tax credits had been applied to their pay slip, so that was 4,000 euro that they got straight away. They also applied for a tax rebate of 1,150 euro. They use their relocation expenses that you get through the HSE in their mortgage application to cover their legal fees. So they didn't realize they were able to use €1,000 towards their legal fees, which they were delighted with. And we also optimized their health insurance, so we got them onto a plan that provided all they needed for much cheaper premium. So all in all, they were €10,600 better off than they had been before they access all the professional financial services. So it really is an important investment into your financial well-being. So that's pretty much it. That's a summary of who we are, what Denovo is, and how we think it can help people. We really appreciate the time today. We really appreciate the support. The more people we get on the platform, even with the free memberships, the better we can make the platform, the more negotiating power we have with our professional partners, so that we can provide really a lot of value at a reduced cost. And we're constantly trying to make it better. We're open to feedback and requests all the time. You can contact us at info@denovo.ie. The cost for the professional services, if anyone's interested, is €250 a year. Now, because this is such a big group, we've spoken to our partners and they're happy to give a discount of €100 to anyone who's interested, just to this group. So I would ask if anyone is going to use a discount code. I'm not going to share it here. I might ask Ali to share it privately in your group later on, and that you keep it within the group, just because our partners are kind of quite keen to keep the offer just within this group. And if you have any questions, I'm free to take a few questions. Otherwise, thanks very much for your time. Some wonderful talks today as well. I wish I had some information available like that when I was applying for the GP scheme. And yeah, thanks very much.
Right then, Oshin, that was wonderful again. I think you highlighted really well about the financial needs for the doctors that your group that you have created will be a wonderful resource to address all of those issues. And as you told already, the subscription annual fee is €250 a year. But we have successful negotiations with the team, Denovo, Dr. Oshin, and the rest of the team. And we're happy to announce that anyone who joins from the platform of Doctors Relocation Ireland will get a discount of €100. That is 40% of the total charge. And thanks very much, Oshin, Kevin, your colleague, and your other colleague, Tony, as well. And I suppose everything you said was excellent. Apart from one thing, and just on a lighter mood, I think that was 2021 when we met in the Wexford General Hospital. Yeah. And yeah, it looks like we're old friends. Yeah, but it was only 5 years. Excellent. Okay, so thanks very much, everyone. Wonderful so far. I would probably go to the last part of the session today, which is questions and answers. We have good few questions already that Talha has discussed, addressed already in the chat box. I have got plenty of questions in my inbox, in my mobile, different queries from the people who are going to appear in the interviews. And I suppose the most frequently asked question when I myself was appearing in a GP interview does the residency status of a person matters? Do you have a stamp 4? Do you not have a stamp 4? Do you have a passport? I let any one of you guys, Dr. Talha, Khalid, or Tiago, to respond to this question, please.
Thank you, Dr. Ali, for the question. If I share my experience, I got into BST without a stamp 4. So that's my personal experience. And the simplest answer is I don't think so. You need a stamp 4 to enter. The rules are changing with every passing year, and the rules are very, very clear in the RCPI website. But it's not the only factor that matters when you're entering into a scheme. Like Tiago had mentioned earlier when we were starting our slides, there are marks for each and everything. So people usually think it's only the stamp 4 that matters when you're entering into a scheme, but that's not the only thing. Even if it matters, it carries very minimal kind of weightage. In my personal experience, if I can get into a training scheme without a stamp 4, I think anyone can. So that's my answer for that.
Wonderful. But just to give everyone an idea that three of the panelists here, Dr. Talha, Tiago, and Khaled, and myself as well, I think myself, I don't have an Irish passport at the moment. We all got training slots, so just be positive on the day of interview. Don't worry too much about that in your mind. I have another very frequently asked question that can someone change hospital during the BST?
I can take that question if you don't mind. So essentially, you can within the hospital group that you're in. So let's say if you're in the Beaumont group, so Beaumont has Beaumont, Connolly, Drogheda. So you can change between Beaumont and Connolly, but you'll have to do at least 6 months in Drogheda because Drogheda is considered the peripheral hospital for this scheme. So it needs to be within the scheme that you're in. So each scheme, that's the Dublin North East scheme. Each scheme has its own hospital group, so you can change, but make sure that you meet the guidelines set by RCPI because you will need to do the 6 months in the peripheral hospital, as we said, and you will need to meet 3 of the 5 core specialties. And just a correction to Ali, I was actually born in Ireland, so that excludes me.
That's perfect. That's great. All right. I have another question. What should I do if I don't know the answer of a question in an interview or if I don't understand the question? Probably the first one will be more relevant. If I don't know the answer, what will I do?
I can take that again. So I think throughout my presentation, I focused on only one thing. You don't, like Khalid mentioned as well, you don't they don't expect you to know each and everything. What they're expecting in an interview is your approach and how you take the question. So if you don't know anything, don't be blank. Say whatever you know. So follow the approach. Everyone can say, I will take a history, I will examine the patient, I will do the relevant workup, I will escalate to seniors, I will document each and everything, I will update the next of kin, I will follow on my patient, how my patient is doing. So just to give an example, I think few basic things anyone can tell that. If you don't know a specific treatment, let's for example say if a patient is admitted via ED with symptomatic bradycardia and you don't know you should be giving atropine or any specific drug, you can say that I will check the hospital protocol, I will check the local guidelines, I will consult my senior, and then I will approach accordingly. So it's better to be a safe doctor and it's better to follow the approach and guidelines rather than saying wrong things. That would be my approach to that.
Perfect. Okay, that's wonderful, Talha. Thank you very much. And I've some questions for Oshin. Oshin, for the first question that was just posted here, that where can I get the discount code? As Oshin said already, I'll post the discount code after the webinar in our group. If you're not a member of the group, you can request any of the admins and then we'll add you in the group. And another question, Oshin, just to let everyone know that we are thankful to the team Denovo for having a collaboration with Doctors Relocation Ireland and the discount that you guys have offered to us. And just to let everyone know as well that Doctors Relocation Ireland itself does not have any kind of financial gains, or in this, what we are doing is just purely for the purpose of helping the doctors in country. Oshin, I have a question that if someone joins in the middle of the year, say in July or August, does he or she has to pay for rest of the year, or is it monthly, or what do you guys how do you guys will handle that?
Yeah, so first of all, a lot of people will have a huge benefit just from a free account. Not everyone will need kind of professional financial services straight away, and kind of we've tried really hard to make it as useful as possible and answer all the questions we were looking for answers um, for anyone who signs up to account. So there's no cost at all for that, and to use all the tools as well. In terms of access to the professional kind of services with our partners, obviously they do charge a fee. So the the cost is it's an annual cost of €250. So you'll be a member for a full year, or 250 minus 100 with the discount. So yeah, it'll be a full 12-month period that you'll be a member for. And we'd really encourage you to make sure you use every single service available to you, because if you do, you'll really get huge value. Even if you just use one service, it's probably less than it would cost if you went directly to a financial services provider. So, but like it's really important that you maximize the value is if you do decide to pay for it and engage with all the services, because you're really nothing to lose and lots to gain. So you can pay the fee annually. I think the discount is just set up for the annual fee. There is an option to pay the annual cost over a 12-month period. So it'll be, I think it's 20 something a month. So that's an option as well if you don't want to part with a lump sum, but you want to access the services. So, and then if there's any questions at all, like or you're wondering about the fee structure, just fire us an email and we can we'll answer, no problem.
That's wonderful. Thank you, Oshin. I suppose the benefit at the end of using the services probably be more than what the people will be paying. I have another question for you, Oshin, and that was just posted in the chat box, that is Denovo for everyone, or is it only for training doctors, or is it only for the doctors only, or is it for the consultants, or the other healthcare workers as well? What you think?
It's mainly focused, primarily focused on all NCHDs. So, to answer all the questions we had when we were NCHDs, and that's everybody who works in a hospital in Ireland. So you don't have to be on a training scheme. You don't have to be any specific type of doctor. Anyone working in the HSE as a doctor will benefit from it. We will support people right up through consultancy. Obviously, consultants may have kind of more specific needs, and they'll speak to kind of people that are qualified to deal with those kind of careers through SYS. But yeah, any doctor can access Denovo and will benefit from it, we think.
Perfect. Thanks, Oshin. I know we are a little bit over the time, but the session has been so interesting that I couldn't stop anyone. The team in the BST preparatory session, I have another question for you, and probably be the last question. If in a conflict scenario, when a member of your own team is involved, what would you do? If any one of you can take this question, Talha or Dr. Khalid.
Yeah, so I think in one of my slides, I shared a conflict scenario as well. So there's a systematic approach to that, but the important thing to note in that kind of scenario is that you don't need to be judgmental towards your colleague. You need to have a clear plan of action. You need to sit with your colleague. You need to know what his or her views are, and you can share your views to him or her. And the prime and main focus should be the patient safety and the patient outcome. So you can phrase your sentences the way you like, but that should be the approach in at the back of your mind, that you're not saying things in a confrontational manner to your colleague. your focus should be your patient's outcome, and you should have a clear frame of mind that why you are doing what you're doing right now. So have a clear plan of action.
That's wonderful, Talha. I suppose with this answer, I would like to conclude today's session. And once again, Talha, yourself, Dr. Khalid, Kihani, Tiago, Emerald, and Oshin, thanks very much for joining today and giving us the time on Saturday. I think that was a wonderful session today, and I think you guys were amazing in explaining everything. And yes, on the ending note, what I got from today's session and what is my own experience sitting in the interview, I'd have one advice for everyone. Listen, it's your time. Just flaunt. Just sell yourself in the best way. If you make up to this far, you're a star. And you are a star, so you need to shine, and you will shine on the day of the interview. And once you shine, you'll definitely get the best results. I wish you all the best of the luck, and thanks very much for joining today's section from the platform of Doctors Relocation Ireland. Thank you.